Welcome to the module Injection Safety, Safe Injection Practices of Frontline Forces Training presented by Superior Health Quality Alliance or Superior Health. This learning module was developed for direct caregivers working in multiple healthcare settings who care for a variety of patients. This module is also relevant for family members caring for a loved one in the home, as well as for individuals who administer their own medications through the administration route of injection. The purpose of this course is to further your learning and knowledge about injection safety. The information obtained and how the learner uses the information will improve the quality and safety in the delivery of care for patients, healthcare professionals, and others. This learning module, Injection Safety Practices, is part of a series of modules exploring injection safety guidance and protocols. You are viewing the first module of a three-part series which provides a general overview about injection safety practices. The second module provides a general overview about intramuscular injections and proper techniques, and the third module focuses on infection control practices. This three-part series can be viewed in any order, but it is recommended to do so in the suggested three-step order. It is not necessary to complete the entire series of modules in one sitting. You can leave and return to any module at any time. Once you've completed this learning module, you may test your knowledge and understanding of the material by completing the quiz. After reviewing this module, the learner will be able to define injection safety, discuss the risk factors associated with unsafe injection practices, discuss the prevention of unsafe injection practices and promoting harm reduction, identify how to correctly report injection adverse reactions, discuss the Safe Injection Practices Coalition, and be able to explain the purpose of the injection safety checklist. Injection safety, or safe injection practices, is a set of measures taken to administer injections in an optimally safe manner for patients, healthcare professionals, and others. A safe injection does not harm the recipient. A safe injection does not expose the provider to any avoidable risks. And finally, a safe injection does not result in waste that is dangerous and harmful to individuals within the community. Because injections are the most commonly used procedures in healthcare, unsafe injection practices carry the risk of significant injury to patients and those administering an injection, along with the opportunity in the transmission of life-threatening blood-borne diseases that could potentially be fatal, such as human immunodeficiency virus, or HIV, hepatitis B virus, and the hepatitis C virus, between one patient and another patient, or between a patient and healthcare professional. Safe injection practices are not optional. Injection safety is essential. Unfortunate events related to needle sticks, such as transmissions of disease, injuries caused by injection safety noncompliance, and potential lawsuits, serve as a reminder of the consequences of failing to maintain adherence to safe injection practices. Injection safety practices are central to patient safety. To prevent the risk of injection injury, it is essential safe practices are implemented. Although safety devices and work practices have been shown to reduce injury, they alone will not prevent all needle-related injuries. Individuals should use a multi-component approach to reduce harm. To promote safe infection practices, an individual should create a culture of safety. A culture of safety can enhance the success of patient safety program. Creating a culture of injection safety also incorporates safe injection strategies from an organizational perspective. An example being, instead of punitive action, leadership encourages and rewards recognition and reporting of an adverse event or near miss. Avoid injection overuse. The more injections administered, the more people are exposed to a potential injection injury. Over 16 billion injections are administered annually around the world, and that number has significantly increased since the distribution of COVID-19 vaccines and boosters. With only 5% of injections given for immunization purposes and 5% for contraceptive use and other reasons, 90% of all injections are for medical therapeutic reasons. Therefore, if another equivalent alternate route for medicine or therapeutic reasons is available, the oral, rectal, or topical route should be encouraged to avoid an injection injury. Individuals who are responsible for administering an injection may lack the knowledge and awareness of the risks associated with unsafe injection practices. Therefore, to promote safe injection practices, it is essential the person is provided with education and training, and competency should be validated. For competency validation, individuals should be observed while setting up, preparing, and administering an injection, and their competency should be documented. In addition, in many community settings, untrained individuals are permitted to administer injections without any additional follow-up associated with their competency. The lack of education and training increases the risk of injury. Any individual responsible for administering an injection in any form must be aware that unsafe injection practices can be a serious threat to not only the health of the patient, but to their health as well. Therefore, appropriate education, training, and compliance through a robust auditing process has proven to reduce injection injuries. In addition, employers should provide staff with skills to intervene when they see unsafe injection practices through education. Additional opportunities to promote safe injection practices includes many of the injuries classified as non-preventable have occurred when a patient moves during the injection process. Therefore, identifying the emotional and cognitive state of the patient helps to prevent injury. Assess if the patient has any potential emotional and/or cognitive challenges that could result in the patient moving during the injection procedure. Preparing and alerting the patient before the injection may prevent some of these injuries. Prior to administering an injection, the provider should plan to spend more time with a patient to offer emotional support and education to enhance a positive experience. Additional interventions to prevent an injection injury is to consider the time of day for talking about and giving an injection to patients. An example would be a patient with dementia, as they may experience sundowning in the late afternoon or early evenings, which may cause confusion, emotional difficulties, and anxiety. Therefore, it may be more beneficial to administer an injection earlier in the day. Use a comforting and familiar space for giving an injection, and understand that tone of voice, body posture, quick movements, noise, change in routines, and unfamiliar surroundings can cause challenging behaviors in patients with cognitive and emotional difficulties. Another opportunity to promote safe injection practices involve proper waste management by promptly disposing and conveniently placing used or contaminated needles in an appropriate disposal container that is closable, leak-proof on the sides and bottom, and puncture-resistant. It is also important that an individual identifies the location of the sharps disposable container prior to giving an injection. If movable, the sharps container should be moved to the point of use as appropriate for immediate needle disposal. More information regarding proper disposal of used needles in the home care setting can be obtained by a patient's local pharmacy or by going to safeneedledisposal.org. In addition, steps for safe injection practices should be provided in an organization's safety injection policies and procedures. A comprehensive, skill-based written injection safety policy should be established and easily obtained. Injection safe policies should be updated annually and supported by evidence-based practices. Individuals responsible for giving an injection should be required to adhere to an organization's policy and procedure to prevent any potential injection injury, as the intent of policies and procedures are to promote adherence with recognized professional practices while promoting compliance with current regulations. And the final opportunity entails the implementation of surveillance programs which provide in-depth analysis of adverse events and can be an effective tool for obtaining information. The goal of these programs should include determining the rate of injuries, investigating the factors that cause injuries, ensuring that injured workers receive proper treatment, identify areas in which the prevention programs needs improvement, and leading to practice strategies for identifying the root cause leading to an adverse event or a near miss. Preventing unsafe injection practices by reducing harm can be achieved through numerous opportunities. Data shows that the risk of needle injury begins at the moment the needle is immediately exposed and ends once the needle is permanently removed from exposure in the working environment. The reduction of distractions and interruptions allows the individual administering the injection to focus on their technique and eliminates the threat to their overall performance and the diversion of their attention. Therefore, to promote safe practices, any person administering an injection needs to have an awareness of the risk of injury throughout the complete injection process. Any form of injection should be prepared, administered, and discarded in an environment with the least number of distractions, some of the common distractions being conversations with multiple people, telephones ringing, bed and wheelchair alarms, and family and visitor interruptions. The utilization of safe equipment is imperative to reduce injection injuries. The risk of sustaining a needle stick injury is eliminated when the needles are substituted with an alternative needleless system or through an adoption of a needleless system, safety syringes, and a pre-filled cartridge needleless system such as an insulin pen. Adherence to aseptic technique defined by the Centers for Disease Control and Prevention, or CDC, as the manner of handling, preparing, and storing of medications and injection equipment or supplies prevents microbial contamination. A new sterile syringe and sterile needle should be used for any injection to prevent the transmission of infectious diseases caused by contamination. Both needle and syringe must be properly discarded once they have been used. It is not safe to change the needle and reuse the syringe, as this practice can transmit disease. To reduce needle injuries, a person should avoid workarounds, which is a process that bypasses a procedure, policy, or problem in a system. Workarounds fail to follow agency policy or ensure safe practices. Unfortunately, there are unintended negative consequences of workarounds that increase the risk of injury to both the patient and provider. Workarounds can be avoided when adhering to policy and procedures and following correct technique. Harm reduction can be reduced through the promotion of individual accountability. Accountability is achieved by adhering to safe practices, reporting injection injuries and near misses, along with actively participating in training for new safety devices, completing initial and annual education in a timely manner, and properly using needle safety features. Harm reduction is also emphasized by using a reporting system. A robust reporting system should be maintained when investigating unsafe injection practices as part of risk management and quality improvement. A record of injuries and near misses helps to identify hazards and systems that need to be corrected. A record of safe behaviors also validates what practices are safest among specific groups and departments in preventing needle stick injuries. Communicating best practices to staff, patients, and individuals administering injections, as well as advertising changes made in direct response to hazard practices, is also important. It helps to close the loop and lets individuals know that concerns associated with injection safety are real. Through the process of identifying hazards related to injection injuries, safety rounds are an approach to promoting injection safety. It also allows management to see what types of issues and hazards need to be addressed. In addition, a system for reporting hazards, either through an intranet-based system or a paper reporting system, provides a mechanism for staff to alert management of hazards faced by employees. Hazards can be reported anonymously or by name. This system is used to acknowledge staff for their contribution to the safety process. If a patient has an adverse reaction after administration of any form of injection, the healthcare provider should review the vaccine adverse event reporting system and follow reporting directions as appropriate. More information about when, what, and how to report is available on the VAERS website. The Safe Injections Practices Coalition is a partnership of healthcare-related organizations, patient advocacy organizations, industry partners, and other public health partners led by the CDC. The CDC Foundation is the convening partner of the coalition, formed to promote safe injection practices in all U.S. healthcare settings. SIPC has created educational resources to remind healthcare providers across all settings and specialties about the basics of injection safety. The education resources can be used for staff training and auditing purposes, as well as for patient education. The Safety Injection Practices Coalition is also responsible for leading the One and Only campaign, which is a public health effort to eliminate unsafe medical injection emphasizing one needle, one syringe, only one time. The campaign's goal is to make sure that patients are protected each time they receive an injectable medication. More information regarding the Safe Injection Practices Coalition and the One and Only campaign can be found on the CDC website. Adhering to injection safety best practices is critical to patient safety. To promote standardization in injection safety, the CDC has developed a user-friendly injection safety checklist. The checklist is an injection safety assessment tool. This tool provides a core set of items based upon the steps that make an injection practice safe. The checklist can be used in both the inpatient and outpatient setting. More information regarding the injection safety checklist can be found on the CDC website. The link is included on the Frontline Forces webpage or in the YouTube description below. Congratulations, you've successfully completed this module. It is now time to test your knowledge by taking the quiz. Click on the link for the Injection Safety Safe Injection Practices quiz on the Frontline Forces webpage or in the YouTube description below.